So fundamentally, what are the reasons for the origin of resting membrane potential? It's simple, isn't it? That cell membrane is more permeable to potassium ions at rest due to the presence of the leaky channels. However, it is not permeable to sodium ions that much. It is very less permeable. And membrane is not permeable to negatively charged proteins. That is why it is maintaining the negativity inside. If the membrane was permeable to proteins also, then along with the potassium, proteins will also move and they will be electroneutral condition. Okay, so membrane is not permeable to negatively charged protein. It is a very important factor for generation of resting membrane potential. And due to the differential permeability of the membrane to these ions, there develops a concentration difference of potassium and sodium across the cell membrane. So in short, who generates this concentration gradient? It is the Gibbs-Donner equilibrium. But there is also a role of sodium-potassium ATPase which maintains the concentration gradient for sodium and potassium. See what happens that when we studied about a Gibbs-Donner equilibrium, we said that the membrane is only leaky to potassium ions. But in reality, some sodium also leaks from outside to inside continuously. And also when the cells are stimulated, what happens? The sodium comes from outside to inside. So this concentration gradient of sodium and potassium will be disturbed because in action potential, sodium moves from outside to inside and potassium also continuously moves from inside to outside because of the change in permeability of the membrane to these ions. So to maintain concentration gradient, sodium-potassium ATPase works by throwing out 3 sodium ions from inside to outside against its concentration gradient and bringing in 2 potassium ions from outside to inside again it's against its concentration gradient. So sodium potassium ATPase has a crucial role in maintaining this concentration gradient for sodium and potassium. Plus you see, because it works with 3 sodium ions and 2 potassium ions, there is a difference in the positivity. You see, it is continuously throwing more positive ions from inside to outside and bringing in less positive ions. Only 2 potassium ions are brought from outside to inside. So by the virtue of this, it also contributes a little to the resting membrane potential. Approximately minus 4 millivolt of resting membrane potential is due to the functioning of sodium potassium ATPase. So it has 2 roles: maintaining the concentration gradient, and it also generates minus 4 millivolt of electronegativity inside the membrane. So how much is the developed potential? Can we determine that? Yes, we can determine that by using an equation known as Nernst equation. So for that, we need to know the concentration of the ion outside and the concentration of the ion inside the membrane, and it is defined as RT by ZF into log concentration of ion outside divided by concentration of ion inside the cell, where here RT is R is gas constant, T is absolute temperature, Z is the valency of the ion, and F is Faraday's constant. We will not go into the mathematics of this, but with the Nernst equation, one thing should be clear, that it assumes full permeability of the membrane for that particular ion. That means the membrane cannot increase its permeability anymore and the ion can freely move across the membrane. So when we solve this equation at 37 degrees Celsius, that is the body temperature, and with the putting the concentrations of potassium ions, then what we get is that if we consider that the membrane is fully permeable to potassium ions, then the potential developed will be minus 97 millivolt. But you see, here we have to use the term EK, and this is what is known as equilibrium constant. Now see, from the beginning when we are talking about Gibbs-Donner equilibrium, we are only considering one ion, that is the potassium ion, right? So the potential developed across the membrane when the membrane is fully permeable to potassium ion is equal to equilibrium constant of potassium ion, and that is minus 97 millivolt. However, suppose we consider another situation where the membrane is fully permeable only to chloride ions, right? So, in that case, the equilibrium constant for chloride or resting membrane potential developed due to the chloride ions, it will be minus 90 millivolt. While for sodium, it will be plus 66 millivolt. So, for solving this equation, we have to input the concentration of these ions in here, and then we can solve the equation for only one particular ion. Remember that. Okay. Anyways, just to simplify this equation, because we will not go into the maths of that, we can say equilibrium constant in millivolts is equal to plus minus 61.5 log to the base 10 concentration of the ion inside the membrane and concentration of the ion outside the cell. Okay. But you see here that we have used plus minus, right? So, which one to use? Well, when we are considering a positive ion, then this we will use as minus. So, minus 61.5 log concentration of say potassium ions inside and concentration of potassium ion outside. And when we are considering a negative ion, then here we have to use a plus sign. Fine.